Hi, my name is Pamela Zambrano Pincay and I'm going to talk about high blood sugar. Definition is a condition in which an excessive amount of glucose circulates in the blood plasma. This is generally a glucose level higher than 200 milligrams, but symptoms may not start to become noticeable until even higher values such as 200 and 300. Signs and symptoms are constant hunger, unexplained weight loss, weight gain, flu-like symptoms including weakness and fatigue, blurred vision, slow healing of cuts or bruises, tingling or loss of feeling in hands or feet, recurring gum or skin infections, recurring vaginal or bladder infections. Pre-diabetes
Pre-diabetes
is
is when your blood glucose
in
levels
which
are higher than
some,
normal but not
not
high enough
all
to mean
of
you
the
have diabetes.
diagnostic criteria
Pre-diabetes
for
is sometimes called
are
impaired
met.
glucose tolerance
It is
or impaired
often
fasting
described
glucose.
as the gray
Most people with
area
pre-diabetes
between
have no
normal
symptoms,
blood
and it can only be
sugar
detected with blood tests.
and diabetes
Having
levels.
pre-diabetes means you are likely to develop type 2 diabetes, and you could already be experiencing its health consequences.
Classification for pre-diabetes: impaired fasting glucose and impaired glucose tolerance. Causes: sleep disorder, family history of diabetes, impaired glucose level and or metabolic syndrome, cardiovascular diseases, hypertension, high blood sugar, increased triglyceride levels, low level of good cholesterol, overweight or obese, women who have had gestational diabetes. Diabetes mellitus is
However,
a group
in
of
some people, the
metabolic
system doesn't work
diseases
properly
in
and they
which
develop
person
diabetes.
has high blood sugar,
There are two main types
either
of
because
diabetes,
the
type
pancreas
1
does
and
not
type 2.
produce enough insulin, or because cells don't respond to the insulin that is produced. Diabetes mellitus type 1. Type 1 diabetes mellitus is characterized by loss of the insulin producing beta cells of the islet of Langerhans in pancreas, leading to insulin deficiency. This type can be further classified as immune-mediated or idiopathic. The majority of type 1 diabetes is of the immune-mediated nature, in which beta cells loss is a T-cell-mediated autoimmune attack. Results from the body's
In type 1 diabetes, the body isn't making any insulin at all. This is because of an autoimmune response, whereby the body has destroyed the insulin-producing cells in the pancreas. We don't entirely know why that happens in some people and not in others.
IDDM.
Type 1 diabetes accounts for about 15% of all cases. It's most often found in the under 40s, and it's by far the most common type of diabetes found in childhood.
Type 2 diabetes is the most common type. In the early stage of type 2, the predominant abnormality is reduced insulin sensitivity. At this stage, hyperglycemia can be reversed by a variety of measures and medication that improve insulin sensitive or reduce glucose production by the liver.
Type 2 diabetes accounts for about 85% of all cases in the population. It's most common in the over 40 age group in the white population and in the over 25 age group in the black or South Asian population. Type 2 diabetes is a little more complex because of slightly more processes at work. Either the body isn't producing quite enough insulin, or the insulin it is producing isn't working properly. That can be due to being overweight, because a build-up of fat can stop insulin doing its job properly, but it can also happen in people of a healthy weight.
The third main form Gestational diabetes occurs when pregnant women without a previous diagnosis of diabetes develop a high blood glucose level. It might precede development of type 2 diabetes mellitus. Other forms of diabetes mellitus include congenital diabetes, which is due to genetic defects of insulin secretion, cystic fibrosis-related diabetes, steroid diabetes induced by high doses of glucocorticoids, and several forms of monogenic diabetes.